The emergency helicopter touched down at Landstuhl Regional Medical Center with rotors still spinning, its cargo more precious than any general had a right to expect. General Marcus Thornfield lay strapped to the gurney, his dress uniform torn and bloodied from the IED blast that had nearly claimed his life 3 hours earlier in Afghanistan. Through the haze of morphine and pain, one thought dominated his military mind. He needed the absolute best surgeon this hospital could provide. The trauma team rushed him through automatic doors while medics rattled off vitals and injury assessments. Shrapnel wounds to the abdomen, potential internal bleeding, possible spleen damage. As they wheeled him toward the trauma bay, General Thornfield grabbed the sleeve of the nearest doctor with surprising strength for a man whose blood pressure was dropping by the minute. "Get me your best surgeon," he commanded, his voice carrying the authority of 30 years in uniform despite the oxygen mask covering half his face. "I want the top man in this hospital. Not some resident, not some junior attending. Your absolute best." The emergency physician nodded quickly, already reaching for his radio. "We'll get Dr. Vasquez immediately, General. She's our chief trauma surgeon and the best we have." The general's grip loosened slightly, confusion flickering across his weathered features. "She? No. Son, you misunderstood me. I need your best surgeon, the man who runs this trauma department." "Sir, Dr. Elena Vasquez is our department chief," the physician explained gently while nurses began cutting away the general's uniform. "She's performed over 3,000 trauma surgeries and has the lowest mortality rate in the European theater." But the general's eyes had already closed, whether from pain or disbelief, leaving the medical team to exchange knowing glances. They had seen this reaction before, though rarely from someone whose life literally depended on setting aside his assumptions. The nurse nearest his head shook her shoulders slightly and reached for the phone to page Dr. Vasquez's stat. Meanwhile, 3 floors above in the administrative wing, Colonel James Morrison was fielding phone calls from the Pentagon about the general's condition. Every 10 minutes brought another inquiry from Washington about when the best military surgeon would be taking over the case. Morrison found himself in the uncomfortable position of explaining repeatedly that their best surgeon was already on the case, and no, requesting someone else would not improve the general's chances of survival. The general's aide, Captain Sarah Walsh, paced the waiting room with barely contained anxiety. She had served under General Thornfield for 2 years and knew his old-fashioned perspectives on women in combat roles. The irony that his life now depended on a female surgeon was not lost on her, though she kept that observation to herself as concerned staff officers began arriving from the nearby military installations. Back in the trauma bay, nurses prepared the general for emergency surgery while monitoring his vitals with growing concern. His blood pressure continued to drop despite the transfusions, and the CT scan revealed internal bleeding that required immediate intervention. Time was becoming the enemy, and every minute spent in preparation was a minute closer to losing a decorated war hero whose leadership had saved countless lives across multiple deployments. The trauma team moved with practiced efficiency, but whispered conversations revealed the tension everyone felt about the upcoming surgery. Not because they doubted Dr. Vasquez's abilities, but because they knew the general's reaction when he discovered his surgeon's identity. Some had witnessed similar situations before, though none with stakes quite this high or with a patient whose military rank commanded such respect throughout the medical center. As General Thornfield was wheeled toward the operating room, still unconscious from the pre-surgical medications, the hospital's chief administrator made a decision that would later prove controversial. He personally called Dr. Vasquez to warn her about the general's specific request for a male surgeon and his apparent shock at learning a surgeon would be female. The administrator wanted to give her the option of having a male colleague perform the surgery to avoid any complications. Dr. Vasquez's response was immediate and unequivocal. The general requested the best surgeon available, and that surgeon was her. She would not step aside because of someone's gender assumptions, particularly when a life hung in the balance. Her 15 years of trauma surgery experience and impeccable track record spoke louder than any prejudice, and she intended to prove it in the operating room, where skill mattered more than assumptions. The stage was set for a confrontation between old-school military thinking and modern medical excellence, with General Thornfield's life as the ultimate judge of which perspective would prove correct. Dr. Elena Vasquez entered the preoperative room with the confident stride of someone who had saved lives in conditions that would break lesser surgeons. Her surgical scrubs were immaculate, her dark hair pulled back in a precise bun, and her hands steady despite having been pulled from another complex procedure to handle this emergency case. She carried herself with the quiet authority that came from 15 years of making split-second decisions under the most extreme pressure imaginable. General Thornfield had regained consciousness during the pre-surgical preparation, though the pain medications kept him in a hazy state between alertness and confusion. When the door opened and Dr. Vasquez walked in, his reaction was immediate and unmistakable. His eyes widened, then narrowed, and he attempted to sit up despite the restraints and 4 lines connecting him to various monitoring equipment. "Excuse me, miss, where's the surgeon?" he asked, his voice hoarse but still carrying command authority. "I specifically requested your chief of surgery, the best man you have in this hospital." Dr. Vasquez approached his bedside with practiced calm, checking his chart while responding in the professional tone she had perfected over thousands of similar encounters. "General Thornfield, I am Dr. Elena Vasquez, Chief of Trauma Surgery. I will be performing your operation today. Your injuries require immediate attention, and we need to get you into surgery within the next 20 minutes. The general's face flushed despite his blood loss, and he looked past her toward the door as if expecting the real surgeon to walk in behind her. "No, you don't understand. I asked for the best surgeon in this facility, the department chief, the man who runs the trauma unit." "General, I am the department chief," Dr. Vasquez replied patiently, pulling up his CT scans on the bedside monitor. "You have significant internal bleeding from shrapnel wounds, and your spleen shows signs of laceration. Every minute we delay increases the risk of hemorrhagic shock." But the general's military mind struggled to process this information. In 3 decades of service, he had worked almost exclusively with male surgeons at field hospitals and military medical facilities. His experience had taught him that the most skilled trauma surgeons were inevitably men, hardened by years of battlefield medicine and capable of making the tough decisions that separated life from death. "Look, I'm sure you're very competent," he said, attempting diplomacy while his blood pressure monitor continued its alarming descent. "But this is a complex case, and I need someone with extensive combat trauma experience. Someone who has seen the worst cases and knows how to handle them." Dr. Vasquez set down his chart and looked directly into his eyes, her voice remaining steady despite the insult implicit in his words. "General, I have performed over 3,000 trauma surgeries in the past 15 years. I completed my residency at Johns Hopkins, served 2 tours in Iraq with the Army Medical Corps, and have maintained a mortality rate below 2% for complex trauma cases. Your survival depends on getting into surgery immediately, not on the gender of your surgeon." The general's aide, Captain Walsh, entered the room at that moment and immediately sensed the tension. She had hoped to avoid this exact confrontation, knowing her commander's traditional views and Dr. Vasquez's well-deserved reputation. The captain found herself in the impossible position of supporting her superior while recognizing that his prejudices might cost him his life. "General, sir," Captain Walsh said carefully, "Dr. Vasquez has the highest success rate in the European theater. The medical staff here considers her the finest trauma surgeon they have ever worked with." But General Thornfield was not easily swayed. "Captain, surely there must be another option. What about the surgeon who normally handles the most critical cases? The one with the most experience with battlefield injuries?" "Sir, that would be Dr. Vasquez," Captain Walsh replied, her voice barely concealing her frustration. "She is the surgeon who handles the most critical cases. She is the one with the most battlefield experience." As if on cue, 2 nurses entered to begin the final pre-surgical preparations. They moved efficiently around the general's bed, checking equipment and confirming medications, but their sideways glances revealed their awareness of the uncomfortable situation unfolding. One whispered quietly to her colleague about having seen this reaction before, though never from someone whose life hung so precariously in the balance. Before we dive deeper into this story, drop a comment and let us know what state you're watching from. Maybe you've witnessed similar assumptions about capability in your community, where someone's qualifications were questioned based on appearances rather than proven expertise. Dr. Vasquez checked her watch and made a decision that demonstrated why she had earned her position as department chief. General, I understand your concerns, but your blood pressure is dropping and your condition is deteriorating. I can either spend the next 10 minutes discussing my credentials while you continue bleeding internally, or I can save your life in the operating room. The choice is yours, but medically speaking, you do not have 10 minutes to spare. The general's protest died in his throat as another wave of pain washed over him. The monitors around his bed painted an increasingly desperate picture, and even through his medication-induced haze, he could see the concern growing on every face in the room. Dr. Vasquez's words carried an undeniable authority that transcended gender, the kind of confidence that came only from years of successfully facing impossible situations. Captain Walsh stepped closer to the general's bed, her voice gentle but urgent. "Sir, we need to trust the medical team. Dr. Vasquez has saved lives that other surgeons said were hopeless. She has the experience and skill to get you through this." The general's eyes moved between his aide's concerned face and Dr. Vasquez's steady gaze, while the medical equipment around him continued its chorus of warnings about his declining condition. Time had become his enemy, and every second spent in doubt was a second closer to the point where even the most skilled surgeon might not be able to save him. Dr. Vasquez moved to the general's bedside with deliberate precision, her hands beginning the physical examination that would determine the exact extent of his injuries. Despite his continued protests, she worked with a methodical thoroughness that had saved countless lives in combat zones where hesitation meant death. Her fingers probed carefully around the shrapnel entry points, feeling for internal damage while monitoring his responses to pressure and movement. General Thornfield winced as she examined his abdomen, but his discomfort seemed to stem as much from accepting her touch as from the actual pain. Every few seconds, his eyes darted toward the door, clearly hoping that a male colleague would arrive to take over his care. His breathing remained shallow and labored, while the monitors continued their steady decline of vital signs that painted an increasingly urgent medical picture. "Doctor, surely you have a senior partner or department supervisor who could handle this case," he said through gritted teeth as she checked his pulse points. "Someone with more experience in complex battlefield trauma. I've seen what shrapnel can do to a man's insides, and this requires the most experienced hands available." Dr. Vasquez paused her examination to meet his gaze directly, her voice carrying the weight of 15 years spent proving herself in situations exactly like this one. "General, I have removed shrapnel from over 400 combat casualties. I have reconstructed torn spleens, repaired severed arteries, and saved soldiers whose injuries were far more severe than yours. The experience you are requesting is standing right in front of you." But the general's military training had taught him to question any deviation from his expectations, particularly when his life was at stake. In his experience, the surgeons who handled the most critical cases were invariably men who had spent decades honing their skills in the most demanding environments. The idea that a woman could possess the same level of expertise challenged fundamental assumptions he had held throughout his career. "Look, I'm not trying to be difficult," he said, attempting to soften his objections while still maintaining his position. "But in my 30 years of military service, I've worked with the best trauma surgeons in the world. The ones who save lives when everyone else has given up. Those surgeons have always been men with decades of battlefield experience." Dr. Vasquez continued her examination, checking his reflexes and testing his responses to various stimuli while addressing his concerns with patient professionalism. "General, I completed my surgical training at one of the most demanding trauma centers in the country. I served 2 combat tours in Iraq, where I performed surgery under mortar fire and save lives in conditions that would challenge any surgeon regardless of gender. My success rate speaks for itself. The general's aide, Captain Walsh, stood near the foot of the bed watching this exchange with growing concern. She had reviewed Dr. Vasquez's credentials before arriving at the hospital and knew that her commander's doubts were based on prejudice rather than medical facts. The captain found herself in the difficult position of wanting to support her superior while recognizing that his stubbornness might cost him his life. "Sir," Captain Walsh interjected carefully, "I spoke with the hospital administrator, and Dr. Vasquez has performed more successful trauma surgeries than any other surgeon in this facility. Her colleagues describe her as the most skilled surgeon they have ever worked with." The general turned his head toward his aide with visible frustration. "Captain, I understand that everyone here speaks highly of her abilities. But this is not a routine surgery we're discussing. This is complex battlefield trauma that requires the most experienced hands available. Surely there must be another option." Dr. Vasquez finished her physical examination and began reviewing his latest blood work results, which showed concerning drops in hemoglobin levels that indicated continued internal bleeding. The numbers painted a clear picture of a patient whose condition was deteriorating rapidly, despite the general's continued resistance to accepting her as a surgeon. "General Thornfield, your hemoglobin has dropped 2 points since arrival, and your blood pressure is becoming unstable," she said, showing him the lab results on her tablet. "You have active bleeding that will not stop without surgical intervention. Every minute we spend discussing alternatives is a minute closer to hemorrhagic shock. But surely you have colleagues who could assist or take over the case," the general persisted, his voice becoming weaker as blood loss took its toll. "What about the surgeon who normally handles the most complex cases? The one with the most extensive trauma experience?" Dr. Vasquez set down her tablet and looked directly into his eyes with the kind of steady confidence that came only from years of making life-or-death decisions under extreme pressure. "General, I am the surgeon who handles the most complex cases. I am the one with the most extensive trauma experience. When other surgeons encounter cases they cannot handle, they call me." 2 nurses entered the room to begin the final pre-surgical preparations, wheeling in additional equipment and checking the general's 4 lines. Their professional demeanor masked their awareness of the ongoing tension, though occasional glances between them revealed their familiarity with similar situations. One whispered quietly to her colleague about the irony of patients questioning the very person trying to save their lives. The general's condition continued to deteriorate as he struggled with accepting Dr. Vasquez as a surgeon. His skin had grown pale despite the warming blankets, and his responses to questions were becoming slower and less coherent. The medical team around him worked with increasing urgency, preparing for surgery while hoping their patient would stop fighting the very care that could save his life. Dr. Vasquez checked her watch again, noting that precious minutes were slipping away while the general's internal bleeding continued unchecked. She had performed emergency surgery under combat conditions where time meant the difference between life and death, and she recognized the approaching point where even her considerable skills might not be enough to save him. The pre-surgical conference room filled with tension as Dr. Vasquez outlined the complex procedure required to save General Thornfield's life. She stood before a wall-mounted monitor displaying his CT scans, pointing to areas of internal damage while explaining the surgical approach to the assembled medical team. Her voice carried the authority of someone who had performed this exact procedure dozens of times under conditions far more challenging than a sterile operating room. The general lay on the gurney beside them, still conscious enough to follow the discussion despite the increasing doses of pain medication. His eyes remained fixed on Dr. Vasquez as she detailed the intricate steps required to repair his damaged spleen and control the internal bleeding that threatened his life. Every few minutes, he would interrupt with questions that revealed his continued hope that someone else might take over his care. "Doctor, this sounds like an extremely complex procedure," he said weakly, his voice barely audible above the medical equipment monitoring his declining condition. "Are you absolutely certain there isn't a more senior surgeon available?" Perhaps someone who has performed this specific operation more frequently? Dr. Vasquez turned from a monitor to address his concerns with the same patient professionalism she had maintained throughout their interaction. General, I have performed this exact procedure 47 times with a 100% success rate. The technique I will be using is one that I helped develop during my deployment in Iraq, where we saw similar injuries on a regular basis. The surgical team gathered around the conference table nodded in agreement, their respect for Dr. Vasquez evident in their attentive postures and focused expressions. The anesthesiologist, Dr. Marcus Chun, had worked with her for over 8 years and had never seen her lose a patient who reached the operating table alive. The surgical nurses had requested assignment to her team specifically because of her reputation for handling impossible cases. But General Thornfield's military mind continued to resist accepting what his rational thoughts should have acknowledged. He had spent 3 decades in an environment where the most critical decisions were made by men who had proven themselves through years of combat experience. The idea that his life now depended on a woman, regardless of her credentials, challenged assumptions that had guided his entire career. "I understand your success rate is impressive," he said, struggling to maintain his diplomatic tone while his strength continued to ebb. "But surely the hospital has protocols for cases of this complexity. Don't you typically bring in additional surgeons or specialists for procedures involving general officers?" Dr. Vasquez exchanged glances with the surgical team, all of whom had witnessed similar conversations before, though rarely with stakes this high. The head nurse, Patricia Kowalski, stepped forward with 25 years of operating room experience behind her words. "General, Dr. Vasquez is the specialist that other surgeons call when they encounter cases they cannot handle. She is the additional expertise." The general's aide, Captain Walsh, entered the room carrying updates from the Pentagon about the general's condition. Washington was demanding regular reports on his status and asking pointed questions about the surgical team handling his care. The captain found herself in the uncomfortable position of explaining to senior officials that their concerns about the surgeon's qualifications were based on gender rather than medical competence. "Captain," the general said as she approached his gurney, "have you been in contact with Walter Reed? Surely they could recommend a surgeon with more experience in cases like this. Someone who has handled similar injuries involving senior officers." Captain Walsh looked helplessly between her commander and Dr. Vasquez, knowing that any further delay could prove fatal. "Sir, I spoke with the chief of surgery at Walter Reed, and he specifically recommended Dr. Vasquez when I described her injuries. He said that if he were in your position, she would be his first choice." Dr. Vasquez continued her explanation of the surgical procedure, describing the delicate process of removing shrapnel fragments while avoiding damage to surrounding organs. Her detailed knowledge of anatomy and surgical technique impressed even the experienced medical staff, who recognized the level of expertise required to perform such complex operations successfully. "The procedure will require approximately 4 hours," she explained, indicating specific areas on the CT scan where surgical intervention was necessary. "We will need to remove 7 pieces of shrapnel, repair the damaged spleen, and control bleeding from multiple sources. The most critical aspect will be maintaining blood pressure while addressing each injury systematically." General Thornfield listened to her explanation with growing concern, not about her technical knowledge, which was clearly comprehensive, but about her ability to handle the physical demands of such an extended and complex operation. In his experience, the surgeons who performed the most demanding procedures were typically men with the physical stamina to maintain precision for hours under extreme pressure. "Doctor, 4 hours is a long time to maintain the level of concentration required for this type of surgery," he said, his voice growing weaker as blood loss continued to affect his mental clarity. "Are you certain you have the stamina to perform at peak efficiency for that duration?" Dr. Vasquez had heard this question countless times throughout her career, and her response carried the weight of 15 years spent proving that surgical skill had nothing to do with gender and everything to do with training, experience, and dedication. General, my longest surgery lasted 11 hours and 43 minutes. I performed a complete vascular reconstruction on a soldier who had been declared unsalvageable by 3 other surgeons. He returned to active duty 6 months later. The surgical team began wheeling the general toward the operating room as his condition continued to deteriorate. His blood pressure had dropped to dangerous levels, and the medical staff worked with increasing urgency to stabilize him for surgery. Dr. Vasquez walked alongside the gurney, continuing to monitor his vital signs while preparing mentally for the complex procedure ahead. General Thornfield's eyes remained fixed on her face as they moved through the hospital corridors, his expression reflecting the internal struggle between his lifelong assumptions and the medical reality of his situation. Time had become his enemy, and every minute spent doubting the very person trying to save his life brought him closer to the point where even the most skilled surgeon might not be able to help him. General Thornfield's wife arrived at Landstuhl Regional Medical Center with the composed bearing of a woman who had spent 30 years as a military spouse, accustomed to crises, but never quite prepared for the possibility of losing her husband. Margaret Thornfield moved through the hospital corridors with purposeful strides, her silver hair perfectly arranged despite the emergency flight from Virginia that had brought her to Germany in record time. She found her husband in the pre-surgical holding area, surrounded by medical equipment that painted a stark picture of his deteriorating condition. His face had grown pale and drawn, while monitors displayed vital signs that spoke to anyone with medical knowledge of a man whose time was running short. Margaret took his hand gently, her composure faltering only slightly when she felt how cold his fingers had become. "Marcus, thank God you're alive," she whispered, leaning close to his ear while being careful not to disturb the various tubes and wires connecting him to life-sustaining equipment. "I came as soon as they called. The children are flying in from the States, but the surgery can't wait for them to arrive." General Thornfield squeezed her hand weakly, grateful for her presence, but troubled by the situation he found himself facing. "Maggie, there's something you need to know about the surgical team. They want to assign a female surgeon to my case. I've been trying to request someone with more experience, but they keep insisting she's their best option." Margaret's eyebrows raised slightly at this information, her mind immediately grasping the implications of her husband's concerns. In their social circle, which consisted primarily of senior military officers and their families, traditional gender roles remained firmly entrenched. The idea that a woman would be performing life-saving surgery on a decorated general struck her as unusual, if not inappropriate. "Have you spoken to the hospital administration about getting a second opinion?" she asked, her voice carrying the authority of someone accustomed to having her requests taken seriously. "Surely they understand that someone of your rank deserves the most experienced surgeon available." Dr. Vasquez entered the holding area at that moment, carrying updated lab results that showed the general's condition continuing its dangerous decline. She had dealt with concerned family members throughout her career and recognized the mixture of fear and skepticism that often accompanied high-stress medical situations involving loved ones. "Mrs. Thornfield, I'm Dr. Elena Vasquez, Chief of Trauma Surgery," she said, extending her hand in greeting while maintaining the professional demeanor that had served her well in countless similar encounters. "I'll be performing your husband's surgery today. His injuries are serious but manageable, and we need to begin the procedure within the next 15 minutes. Margaret shook the doctor's hand politely, but her expression revealed the same surprise and concern that her husband had displayed upon learning his surgeon's identity. She had expected to meet a seasoned male surgeon with decades of combat trauma experience, not a woman who appeared younger than her own daughter. "Doctor, I'm sure you're very capable," Margaret said carefully, choosing her words to avoid giving offense while still expressing her concerns. "But my husband is a 3-star general with over 30 years of military service. Don't you think this case might require someone with more extensive experience in treating senior officers?" Dr. Vasquez had heard variations of this question hundreds of times throughout her career, and her response carried the patience of someone who understood that family concerns often stemmed from fear rather than malice. "Mrs. Thornfield, I have treated generals, admirals, and senior government officials. Military rank doesn't change anatomy or surgical technique. Your husband's injuries require expertise in trauma surgery, which is exactly what I provide. But Margaret's concerns went beyond simple medical qualifications. In her world, important decisions were made by men who had proven themselves through decades of leadership in challenging environments. The idea that her husband's life would be in the hands of someone who didn't fit that pattern challenged assumptions she had held throughout her adult life. I understand that you're qualified, Margaret continued, her diplomatic training as a military spouse helping her navigate the delicate conversation. But surely there must be other options. What about bringing in a specialist from Walter Reed or Johns Hopkins? Someone with more experience in cases of this complexity? Captain Walsh approached the family group, carrying updates from the Pentagon that added another layer of complexity to an already difficult situation. Senior officials in Washington were asking pointed questions about the medical team handling the general's care, and their concerns seemed to mirror those being expressed by the family. "Ma'am, I've been in contact with the Pentagon, and they're asking about the surgical team," Captain Walsh said quietly to Margaret, glancing nervously at Dr. Vasquez. "They want to know if we've considered bringing in additional specialists or requesting a transfer to a larger medical facility." Dr. Vasquez checked her watch and noted that the general's blood pressure had dropped another 2 points since her last assessment. Time was becoming critical, and every minute spent addressing concerns about her qualifications was a minute closer to the point where surgical intervention might no longer be possible. "Mrs. Thornfield, your husband's condition is deteriorating rapidly," she said, showing Margaret the latest lab results on her tablet. His hemoglobin levels indicate significant internal bleeding, and his blood pressure is approaching the threshold where surgery becomes exponentially more dangerous. "We cannot delay any longer." The general attempted to sit up slightly, his voice weak but still carrying traces of command authority. "Maggie, maybe you could call Colonel Davidson at Walter Reed. He might know someone who could fly in to handle this case. Someone with more experience in battlefield trauma." Margaret looked between her husband and Dr. Vasquez, torn between supporting her husband's wishes and accepting the medical reality that time was running out. The monitors around his bed continued their steady chorus of warnings, while his skin grew increasingly pale despite the warming blankets and blood transfusions. Dr. Vasquez positioned herself where both the general and his wife could see her clearly, her voice carrying the kind of quiet confidence that came only from years of successfully handling impossible situations. "I understand your concerns, but I need you to understand mine. Your husband is dying while we discuss alternatives that don't exist. I am the most qualified surgeon available to save his life, and every minute we spend debating that fact brings him closer to a point where even perfect surgery won't be enough." The harsh reality of her words settled over the family like a cold blanket, forcing them to confront the fact that their preferences might be irrelevant in the face of medical necessity. General Thornfield's breathing had become more labored, and his responses to questions were growing slower and less coherent as blood loss continued to affect his mental clarity. The operating room doors swung open with mechanical precision as General Thornfield was wheeled into the sterile environment that would determine his fate. The space hummed with the quiet efficiency of a trauma center prepared for the most complex procedures, every instrument positioned exactly where Dr. Vasquez would need it during the hours ahead. Bright surgical lights illuminated the operating table, while monitors displayed the general's declining vital signs in stark digital clarity. Dr. Vasquez entered behind the gurney, her hands already scrubbed and her mind focused on the intricate procedure that would soon begin. She had performed this operation dozens of times, but never with a patient who had spent the last hour questioning her qualifications while his life slowly ebbed away. The irony was not lost on her that the man who doubted her abilities was now completely dependent on those same abilities for his survival. The surgical team assembled around the operating table with practiced efficiency, though subtle tensions were evident in their interactions. Dr. Marcus Chun, the anesthesiologist, had worked with Dr. Vasquez for 8 years and knew her capabilities intimately. But he was also aware that this case carried political implications far beyond the medical challenges, with Pentagon officials monitoring every aspect of the general's care. Patricia Kowalski, the head surgical nurse, began arranging instruments with a methodical precision that had made her one of the most respected members of the surgical staff. She had assisted Dr. Vasquez through hundreds of complex procedures and had never seen her lose a patient who reached the operating table alive. Yet she could sense the additional pressure surrounding this particular case. 2 younger surgeons had been called in to assist with the procedure, and their reactions to the situation revealed the generational differences in attitudes toward female surgeons. Dr. James Rodriguez, a third-year resident, watched Dr. Vasquez prepare with obvious admiration, having studied her published papers on battlefield trauma surgery during his medical training. But Dr. William Harper, a more senior surgeon from another department, displayed subtle signs of skepticism that mirrored the general's concerns. He had been practicing medicine for 15 years, primarily in environments where male surgeons dominated the most challenging cases. His presence in the operating room represented the hospital administration's attempt to provide additional expertise, though Dr. Vasquez had not requested assistance. "Is this going to be a teaching case?" Dr. Harper asked Dr. Vasquez as they positioned themselves around the operating table. "Given the patient's rank and the complexity of the injuries, perhaps we should consider a collaborative approach with multiple surgeons taking lead roles." Dr. Vasquez looked up from her final equipment check, her eyes meeting Dr. Harper's across the sterile field. "This is not a teaching case, William. This is a trauma surgery that requires immediate intervention by the most experienced surgeon available. That surgeon is me, and I will be performing this procedure as the sole primary surgeon." The tension in the room increased perceptibly as Dr. Harper's suggestion was politely but firmly rejected. Several team members exchanged glances, recognizing the underlying challenge to Dr. Vasquez's authority that had nothing to do with medical necessity and everything to do with the same gender assumptions that had troubled the general and his family. Dr. Chun began the anesthesia process, his voice steady and professional despite the charged atmosphere. "General Thornfield, I'm going to administer the anesthesia now. When you wake up, Dr. Vasquez will have completed your surgery and you'll be on your way to recovery." The general's eyes found Dr. Vasquez one final time before the anesthesia took effect, his expression revealing the internal struggle between his lifelong prejudices and his desperate need for the medical expertise she represented. His lips moved slightly, as if he wanted to say something, but the medications were already pulling him toward unconsciousness. "Are you absolutely certain you don't want additional surgical support?" Dr. Harper persisted as the general lost consciousness. Cases involving general officers typically warrant extra precautions, and the Pentagon has expressed concerns about having adequate expertise available. Dr. Vasquez began her final examination of the surgical site, her hands moving with the confidence of someone who had performed this procedure under far more challenging conditions than a pristine operating room. "I have removed shrapnel from over 400 combat casualties, William. I have performed emergency surgery under mortar fire in field hospitals with limited equipment. This operating room provides optimal conditions, and I am fully capable of handling this procedure independently." The surgical team watched this exchange with growing awareness that they were witnessing more than just a medical procedure. Dr. Vasquez was fighting not only to save the general's life, but also to prove that her gender was irrelevant to her surgical abilities. Every movement she made would be scrutinized, every decision questioned, every outcome attributed to factors beyond her medical expertise. Patricia Kowalski stepped forward with the authority that came from 25 years of operating room experience. Dr. Vasquez has the lowest mortality rate for complex trauma cases in this hospital's history. If anyone can save the general's life, it's her. Now let's focus on the surgery instead of politics. Dr. Rodriguez positioned himself to assist with the procedure, his respect for Dr. Vasquez evident in his attentive posture and focused expression. He had requested assignment to this case specifically because he wanted to observe her surgical techniques, which were considered innovative approaches to battlefield trauma treatment. The monitors displayed the general's vital signs as Dr. Vasquez made her first incision, revealing the extent of internal damage caused by the IED blast. Shrapnel fragments were visible on the imaging equipment, scattered throughout his abdominal cavity in patterns that would challenge even the most experienced trauma surgeon. Dr. Harper moved closer to observe the procedure, his skepticism gradually giving way to professional curiosity as he watched Dr. Vasquez work with precision that few surgeons could match. Her movements were economical and deliberate, each cut calculated to achieve maximum therapeutic benefit while minimizing additional trauma to surrounding tissues. The first hour of surgery would test not only Dr. Vasquez's technical skills, but also her ability to maintain focus while being observed by colleagues who questioned whether she belonged in that operating room. The general's life hung in the balance, but so did her reputation and the future opportunities for female surgeons who would follow in her footsteps. Time compressed in the operating room as Dr. Vasquez began the delicate process of removing shrapnel fragments while controlling bleeding from multiple sources. Each decision she made carried the weight of proving that surgical excellence had nothing to do with gender and everything to do with training, experience, and dedication to saving lives. Dr. Vasquez made her first incision with the steady precision that had saved hundreds of lives in far more challenging conditions than this pristine operating room. The scalpel moved through tissue layers with practiced efficiency, revealing the extent of damage caused by the IED blast that had nearly claimed General Thornfield's life 3 hours earlier. Blood welled from the incision site, but her movements remained calm and deliberate despite the scrutinizing eyes of colleagues who questioned her presence at the operating table. The monitors displayed the general's vital signs in real time, painting a digital portrait of a man whose body was fighting a losing battle against internal bleeding and shock. His blood pressure hovered dangerously close to the threshold, where surgical intervention became exponentially more difficult, while his heart rate indicated the strain of maintaining circulation with diminished blood volume. Dr. Harper positioned himself directly across from Dr. Vasquez, ostensibly to assist, but clearly to observe every aspect of her surgical technique. His eyes tracked her movements with the intensity of someone looking for any sign of hesitation or error that might justify his skepticism about her capabilities. The other team members sensed the additional tension his presence created in what should have been a collaborative medical environment. First shrapnel fragment located, Dr. Vasquez announced to the team, her voice steady despite the pressure of performing under such intense scrutiny. Metal fragment approximately 2 centimeters embedded in the peritoneal wall. Beginning extraction now. She maneuvered the surgical instruments with the kind of fluid precision that came only from years of handling similar cases under combat conditions. The shrapnel fragment came free, cleanly, dropping into the surgical basin with a metallic clink that seemed unnaturally loud in the hushed operating room. 1 down, 6 more to locate and remove. But as she began searching for the second fragment, complications arose that would test not only her surgical skills, but also her ability to maintain confidence while being watched by doubters. The general's blood pressure dropped suddenly, indicating internal bleeding from a source that wasn't immediately visible on the imaging equipment. "We're losing him," Dr. Chun called out from his position at the head of the table, his voice carrying the urgency of an anesthesiologist who had seen too many patients slip away during critical procedures. Blood pressure dropping to 70/40. "We need to locate that bleeding source immediately." Dr. Vasquez's hands moved deeper into the surgical site, probing carefully for the source of hemorrhaging while maintaining the steady rhythm that had characterized her work throughout the procedure. Her fingers located a torn blood vessel that the imaging equipment had missed, a complication that could prove fatal if not addressed within the next few minutes. "Found it," she announced, her voice remaining calm despite the life-threatening situation developing on the operating table. Arterial bleeding from a vessel damaged by shrapnel fragmentation. Requesting additional suction and clamps. Patricia Kowalski anticipated Dr. Vasquez's needs before she voiced them, positioning instruments exactly where they would be needed for the delicate repair work about to begin. The head nurse had assisted through enough complex procedures to recognize when a surgeon was operating at the highest level of skill, regardless of any doubt expressed by observers. But Dr. Harper's skepticism became more vocal as the complications mounted, his concerns reflecting the same doubts that had troubled General Thornfield and his family. Elena, perhaps we should consider bringing in additional vascular expertise. This type of arterial repair typically requires specialized training that goes beyond standard trauma surgery. Dr. Vasquez continued working without looking up from the surgical site, her hands performing the intricate vascular repair that would determine whether the general survived the next 10 minutes. I have performed over 200 arterial repairs in combat conditions. William. This vessel requires microsurgical technique, which is exactly what I'm providing. Her movements became more precise as she worked to control the bleeding that threatened to overwhelm the general's already compromised cardiovascular system. The monitors displayed vital signs that painted an increasingly desperate picture, while the surgical team watched with growing awareness that they were witnessing a procedure that few surgeons could handle successfully. Dr. Rodriguez observed Dr. Vasquez's technique with fascination, recognizing the innovative approaches to vascular repair that he had studied in her published research. Her methodology combined traditional surgical principles with battlefield adaptations that had been developed under the most extreme conditions imaginable. Blood pressure stabilizing, Dr. Chun announced with obvious relief as Dr. Vasquez completed the vascular repair. We're back to acceptable levels. Heart rate coming down from the crisis threshold. The successful resolution of the first major complication seemed to shift the atmosphere in the operating room slightly, though Dr. Harper's skepticism remained evident in his continued close observation of every aspect of Dr. Vasquez's work. She had proven her ability to handle one crisis, but 6 more shrapnel fragments remained to be located and removed. Second fragment located, Dr. Vasquez announced, moving systematically through the abdominal cavity while monitoring the general's responses to her manipulations. This one is positioned near the spleen, requiring careful extraction to avoid additional organ damage. She approached the delicate removal with the same steady precision that had characterized her work throughout the procedure, despite knowing that every movement was being evaluated by colleagues who had questioned her qualification from the moment she entered the operating room. The fragment came free without additional complications, joining the first piece of metal in the surgical basin. Dr. Harper leaned closer to observe the extraction technique, his professional curiosity beginning to overcome his initial skepticism as he watched Dr. Vasquez handle complications that would challenge even the most experienced trauma surgeons. Her movements displayed a level of skill that was difficult to question, regardless of any preconceptions about gender and surgical capability. The third shrapnel fragment proved more challenging, embedded deep within muscle tissue that had been traumatized by the blast. Dr. Vasquez worked patiently to free the metal without causing additional damage to surrounding structures, her technique demonstrating the kind of surgical judgment that separated exceptional surgeons from merely competent ones. Patricia Kowalski continued to anticipate instrument needs with the efficiency that came from years of working with the hospital's most skilled surgeons. She had assisted through thousands of procedures and could recognize surgical excellence when she observed it, regardless of any external doubts about the surgeon's qualifications. The operating room had settled into the focused rhythm that characterized complex trauma surgery, with each team member contributing their expertise to the collective effort of saving General Thornfield's life. But the underlying tension remained, created by the knowledge that this procedure carried implications far beyond the immediate medical challenges facing the surgical team. 2 hours into the procedure, Dr. Vasquez encountered the complication that would separate her from ordinary surgeons and silence the doubts that had followed her into the operating room. The fourth shrapnel fragment had lodged itself in a position that defied conventional surgical approach, embedded directly adjacent to the hepatic artery in a location that made extraction seem virtually impossible without catastrophic bleeding. The surgical team gathered closer around the operating table as Dr. Vasquez studied the imaging displays that revealed the full extent of the challenge before her. The metal fragment sat less than 2 millimeters from the major blood vessel that supplied the liver, positioned in such a way that any traditional removal technique would likely sever the artery and cause immediate exsanguination. "This is problematic," Dr. Harper said quietly, his voice carrying the weight of 15 years spent handling complex surgical cases. "That fragment is essentially untouchable using standard approaches. We might need to consider leaving it in place and managing the patient conservatively." Dr. Vasquez continued her examination of the surgical site while processing the three-dimensional images that showed the fragment's exact position relative to critical anatomical structures. Her mind raced through surgical options that had been developed in battlefield conditions where conservative management meant certain death and innovation became the only path to survival. "Conservative management is not an option," she replied firmly, her voice carrying the confidence that came from having faced similar challenges in combat hospitals where impossible became routine. "That fragment is causing ongoing tissue damage and will lead to sepsis if not removed. There is a way to extract it safely, but it requires a technique that most surgeons have never attempted." Dr. Chen monitored the general's vital signs with increasing concern as the surgical team debated their options. The patient's condition remained stable but tenuous, balanced on the knife's edge between recovery and catastrophic decline. Every additional minute of surgery increased the risk of complications, yet leaving the fragment in place guaranteed long-term problems that could prove fatal. "Elena, I've never seen anyone attempt extraction from that position," Dr. Harper said, his skepticism now mixed with professional concern for patient safety. "The risk of arterial injury is simply too high. Even the most experienced trauma surgeons would consider this fragment inoperable." But Dr. Vasquez had already begun preparing for a procedure that existed in only a handful of medical journals, a technique she had helped develop during her deployment in Iraq when conventional wisdom failed and innovation meant the difference between life and death for wounded soldiers. Her hands moved with practiced precision as she requested instruments that most surgical teams had never seen used in combination. Patricia Kowalski recognized the unusual instrument selection and realized that Dr. Vasquez was preparing to attempt something extraordinary. The head nurse had assisted through thousands of procedures, but had never seen this particular combination of surgical techniques attempted in a civilian hospital setting. "Dr. Vasquez, are you planning to use the retrograde approach?" Patricia asked, her voice reflecting both admiration and concern for the complexity of what was being proposed. "I've read about that technique in the trauma journals, but I've never seen it performed live." The retrograde approach, combined with microsurgical dissection, Dr. Vasquez confirmed, her voice steady despite the magnitude of what she was attempting. "I developed this technique with a colleague in Baghdad when we encountered similar fragment positions in blast victims. The success rate is 93% when performed correctly." Dr. Rodriguez watched with fascination as Dr. Vasquez began the intricate procedure that would either save the general's life or demonstrate the limits of surgical innovation. The technique required approaching the fragment from an unexpected angle, using microsurgical instruments to dissect tissue planes that had never been separated in traditional surgical approaches. The operating room fell silent except for the steady rhythm of monitoring equipment as Dr. Vasquez began the delicate dissection that would allow access to the embedded fragment. Her movements became even more precise, each cut calculated to avoid the arterial structures that lay mere millimeters away from her instruments. Dr. Harper observed the procedure with growing amazement, recognizing that he was witnessing surgical technique that pushed the boundaries of what he had believed possible. His skepticism began transforming into professional respect as Dr. Vasquez demonstrated mastery of anatomical knowledge and surgical skill that few surgeons could match. "Fascinating approach," he said quietly, his voice now carrying admiration instead of doubt. "I can see the theoretical basis for the technique, but the precision required to execute it safely is extraordinary." 1 millimeter off target would be catastrophic. Dr. Vasquez continued her meticulous dissection, creating a surgical pathway that had never existed before in the general's anatomy. The technique required three-dimensional visualization of anatomical structures combined with the kind of steady hands that came only from years of performing surgery under the most demanding conditions imaginable. "Fragment is visible," she announced to the team, her voice remaining calm despite the complexity of the procedure she was performing. "Beginning extraction sequence using microsurgical technique," requesting absolute stillness from all team members. The operating room became a tableau of focused concentration as every person present understood they were witnessing something exceptional. Dr. Vasquez worked with the kind of precision that belonged more to a research laboratory than a trauma operating room. Yet her technique had been forged in the crucible of battlefield medicine, where perfection was the only acceptable outcome. Dr. Chin monitored vital signs with meticulous attention, knowing that the slightest deviation could indicate complications that would require immediate intervention. The general's body was responding well to the innovative surgical approach, but the most critical moments lay ahead as the actual extraction began. Patricia Kowalski positioned herself to provide optimal assistance, her 25 years of operating room experience allowing her to anticipate needs before they were voiced. She had seen exceptional surgeons throughout her career, but the level of skill being demonstrated exceeded anything in her previous experience. The extraction began with movements so subtle they were barely perceptible to observers. Yet each microadjustment brought the embedded fragment closer to freedom from the tissue that had trapped it since the explosion. Dr. Vasquez worked with the patience of someone who understood that rushing meant failure, and failure meant death. Dr. Harper found himself holding his breath as the procedure reached its most critical phase, his earlier skepticism completely replaced by professional awe at the surgical mastery being displayed before him. He was witnessing technique that would be discussed in medical journals and taught in surgical residency programs for years to come. The fragment moved slightly in response to Dr. Vasquez's manipulations, confirming that extraction was possible if the technique was executed with flawless precision. The next few minutes would determine whether innovation could triumph over seemingly impossible anatomical challenges, and whether General Thornfield would survive to witness his own prejudices proven wrong. The fourth shrapnel fragment came free with a precision that defied medical explanation, sliding cleanly from its embedded position without disturbing the hepatic artery that lay mere millimeters away. The metallic clink as it dropped into the surgical basin seemed to echo through the operating room with unusual resonance, marking the moment when skepticism transformed into undeniable recognition of surgical mastery. Dr. Harper stared at the extraction site in complete silence, his 15 years of surgical experience providing no framework for what he had just witnessed. The technique Dr. Vasquez had employed existed beyond conventional surgical training, representing an innovation born from battlefield necessity and perfected through repetitive exposure to cases that most surgeons would never encounter in their entire careers. "That was extraordinary," he said quietly, his voice carrying none of the skepticism that had characterized his earlier comments. "I've never seen tissue planes separated with that level of precision. The anatomical knowledge required to execute that approach safely is remarkable." Dr. Vasquez continued working without pause, her hands already searching for the fifth shrapnel fragment while the team processed what they had witnessed. Her movements remained steady and methodical despite having just performed a procedure that would be discussed in surgical conferences for years to come. To her, it was simply another challenge overcome through training and experience. "Fifth fragment located," she announced, her voice maintaining the professional calm that had characterized her work throughout the procedure. "This one is positioned near the pancreatic duct, requiring similar microsurgical technique, but from a different anatomical approach." Patricia Kowalski positioned instruments with renewed appreciation for the surgical excellence she was witnessing. In 25 years of operating room experience, she had assisted the hospital's most skilled surgeons, but the level of technical mastery being demonstrated exceeded anything in her previous experience. Every movement Dr. Vasquez made seemed calculated to achieve maximum therapeutic benefit with minimal tissue trauma. Dr. Rodriguez observed the procedure with the fascination of someone witnessing surgical history being made. The techniques he was learning would influence his entire career, providing him with approaches to complex trauma that were not taught in any medical school curriculum. His notebook would later contain detailed descriptions of procedures that existed nowhere else in medical literature. The fifth fragment proved less challenging than its predecessor, positioned in tissue that allowed more conventional surgical access. But Dr. Vasquez's handling of the extraction demonstrated the same meticulous attention to detail that had characterized her approach to the more difficult fragments. Each cut was deliberate, each movement calculated to minimize patient trauma while achieving complete therapeutic success. Dr. Chin monitored the general's vital signs with growing confidence in the surgical outcome. The patient's body was responding exceptionally well to the innovative techniques being employed, with blood pressure remaining stable and heart rate indicating successful stress management, despite the complexity of the procedure being performed. "Elena, I need to ask about your training," Dr. Harper said as the fifth fragment joined its companions in the surgical basin. "The techniques you're using weren't covered in my surgical residency or fellowship programs. Where did you learn to perform these procedures?" "Combat hospitals in Iraq and Afghanistan," Dr. Vasquez replied while beginning her search for the sixth shrapnel fragment. "When conventional approaches fail and the patient will die without intervention, you innovate or you lose them. These techniques were developed out of necessity and refined through repetitive exposure to cases that civilian hospitals rarely encounter." She located the sixth fragment embedded in muscle tissue that had been severely traumatized by the blast. The metal piece sat in a position that would normally require extensive tissue removal to achieve surgical access. But Dr. Vasquez approached the extraction using minimally invasive techniques that preserved healthy tissue while still achieving complete fragment removal. The surgical team watched with growing amazement as she employed instruments and combinations that created new possibilities for tissue access and fragment extraction. Her knowledge of anatomical relationships allowed her to work through tissue planes that other surgeons might not even recognize as viable surgical pathways. "Patricia, have you seen these instrument combinations before?" Dr. Rodriguez asked quietly, his voice reflecting the awe that everyone in the operating room was experiencing. "The way she's using microsurgical tools in combination with standard trauma instruments is creating approaches I've never encountered." "Never," Patricia replied, her voice carrying 25 years of operating room authority. "Dr. Vasquez is demonstrating surgical innovation that goes beyond anything I've assisted with in my entire career. These techniques should be taught in surgical residency programs across the country." Dr. Vasquez completed the sixth extraction with the same precision that had characterized her work throughout the procedure, despite knowing that every movement was being evaluated by colleagues who had initially questioned her qualifications. The fragment came free cleanly, leaving minimal tissue damage and no complications that would compromise the general's recovery. The seventh and final fragment required the most delicate approach of all, positioned near nerve structures that controlled essential bodily functions. Any damage to these neural pathways could result in permanent disability despite successful removal of all foreign material from the general's body. "Final fragment located," Dr. Vasquez announced, her voice steady despite the critical nature of the extraction about to be performed. "Position requires neural preservation techniques to avoid permanent functional loss. Beginning microsurgical dissection now." Dr. Harper leaned closer to observe the final extraction, his skepticism completely replaced by professional admiration for surgical skill that exceeded anything he had witnessed in his medical career. The precision required to work safely near critical neural structures demanded steady hands and anatomical knowledge that few surgeons possessed. The operating room fell silent except for monitoring equipment as Dr. Vasquez performed the most delicate extraction of the entire procedure. Her movements became even more precise, each micro-adjustment calculated to preserve neural function while achieving complete fragment removal from tissue that had been severely traumatized by the blast. Dr. Chun watched vital signs with meticulous attention, knowing that any indication of neural compromise would require immediate intervention to prevent permanent disability. The general's body continued responding well to the surgical techniques being employed, with no signs of the complications that typically accompanied procedures of this complexity. The final shrapnel fragment came free with surgical precision that belonged more in textbooks than real-world operating rooms, completing the extraction sequence without any of the complications that had seemed inevitable when the procedure began. 7 pieces of metal now sat in the surgical basin, representing foreign material that would have eventually killed General Thornfield if left in place. Dr. Vasquez began the closure process with the same meticulous attention to detail that had characterized every aspect of the procedure. Her suturing technique demonstrated mastery of tissue approximation that would minimize scarring while optimizing healing in a patient whose recovery would be closely monitored by medical professionals and Pentagon officials alike. The monitors erupted in urgent alarms as General Thornfield's blood pressure plummeted without warning, transforming what had been a successful surgical procedure into a life-threatening emergency that would test the absolute limits of Dr. Vasquez's abilities. The digital displays painted a desperate picture of cardiovascular collapse, with vital signs indicating that the general was sliding rapidly toward the point where even perfect medical intervention might prove insufficient. "We're losing him," Dr. Chen announced with the controlled urgency of an anesthesiologist who had witnessed too many patients slip away during critical moments. Blood pressure 60/30 and dropping. Heart rate climbing to dangerous levels. Something is causing massive internal bleeding that we haven't identified. Dr. Vasquez's hands moved immediately to the surgical site, probing with practiced precision for the source of hemorrhaging that threatened to undo everything they had accomplished during the past 3 hours. Her fingers searched through tissue that had been meticulously repaired, looking for the hidden bleeding that was draining the general's life away despite their best efforts. The surgical team gathered closer around the operating table as the crisis deepened, their earlier confidence replaced by the focused tension that accompanied medical emergencies where death became a very real possibility. Dr. Harper watched with growing concern as Dr. Vasquez worked to identify bleeding sources that had not been apparent on any of the imaging studies or previous surgical exploration. "I need better visualization," Dr. Vasquez said, her voice maintaining professional calm despite the life-threatening situation developing before them. "Patricia, request emergency blood products and prepare for potential cardiac resuscitation. This hemorrhaging is coming from a source we haven't identified." Dr. Chun increased the rate of blood transfusion while monitoring the general's responses to the cardiovascular crisis that had erupted without warning. The patient's body was fighting to maintain circulation with diminished blood volume, but the ongoing hemorrhaging was overwhelming their ability to replace what was being lost through unknown bleeding sources. Patricia Kowalski moved with the efficiency of 25 years spent handling surgical emergencies, preparing equipment for procedures that might be needed if Dr. Vasquez could not locate and control the mysterious bleeding that threatened the general's survival. Her experience had taught her to anticipate the worst while hoping for surgical miracles. Dr. Vasquez deepened her exploration of the surgical site, her hands working through anatomical structures that had been thoroughly examined during the initial procedure. The bleeding had to be coming from a source that was not immediately visible, possibly from tissue damage that had been masked by the body's initial responses to surgical intervention. "Found something," she announced suddenly, her voice carrying the intensity of someone who had discovered a potentially fatal complication. "There's a delayed rupture of the splenic artery, probably caused by blast trauma that wasn't immediately apparent. The vessel wall was weakened and has now given way under the stress of surgery." Dr. Harper leaned closer to observe as Dr. Vasquez exposed the damaged artery that was pumping the general's lifeblood into his abdominal cavity. The vessel had suffered blast damage that created a weak point in the arterial wall, and the stress of surgical manipulation had finally caused complete rupture at the compromised site. "Elena, that's a major arterial rupture, Dr. Harper said, his voice reflecting the gravity of what they were facing. Splenic artery hemorrhaging at that rate typically requires immediate surgical ligation, but the patient's condition might not allow for the time needed to achieve vascular control. Dr. Vasquez studied the bleeding artery with the analytical mind that had saved lives in situations that other surgeons would have declared hopeless. The conventional approach would require extensive surgical exposure and time that the general simply did not have, given his rapidly deteriorating cardiovascular status and the massive blood loss that continued unabated. "Conventional approach won't work," she said firmly, her hands already positioning instruments for a procedure that existed in only the most advanced surgical literature. "This requires immediate vascular reconstruction using microsurgical technique. I'm going to attempt a primary repair of the arterial wall using battlefield methodology." The operating room fell silent except for the urgent sounds of monitoring equipment as Dr. Vasquez began a procedure that pushed the boundaries of what was considered possible in emergency surgical situations. Her approach required rebuilding the damaged artery while the patient continued bleeding, a technique that demanded precision beyond normal human capability. Dr. Rodriguez watched with fascination and terror as Dr. Vasquez worked with microsurgical instruments to reconstruct arterial tissue that had been shattered by blast forces. The procedure required steady hands despite the time pressure and the knowledge that any mistake would result in immediate exsanguination and death. Patricia positioned suction equipment to maintain visualization while Dr. Vasquez performed microsurgical repairs on tissue that most surgeons would consider too damaged to salvage. The head nurse had never seen anyone attempt arterial reconstruction under such desperate circumstances, with the patient's life measured in minutes rather than hours. "Blood pressure is stabilizing slightly," Dr. Chen reported as Dr. Vasquez completed the first phase of the arterial repair. "We're still in critical territory, but the massive hemorrhaging appears to be slowing. Whatever you're doing is working, but we need definitive control soon." Dr. Vasquez continued her microsurgical reconstruction of the damaged artery, working with the kind of precision that belonged in research laboratories rather than emergency surgical situations. Her technique combined traditional vascular surgery principles with innovations developed in combat hospitals, where conventional wisdom failed and creativity meant survival. The repair required multiple layers of sutures placed with millimeter accuracy while maintaining arterial integrity under extreme time pressure. Dr. Vasquez worked with the steady rhythm that had characterized her entire surgical career, refusing to be hurried despite the knowledge that the general's survival depended on completing the reconstruction within the next few minutes. Dr. Harper observed the procedure with complete amazement, recognizing that he was witnessing surgical technique that would be studied and discussed in medical centers around the world. The level of skill required to perform arterial reconstruction under these circumstances exceeded anything he had encountered in his professional experience. "This is incredible," he said quietly, his voice filled with admiration for surgical mastery that transcended normal human capability. "She's rebuilding that artery under conditions that would challenge the most experienced vascular surgeons working in optimal circumstances." The arterial reconstruction neared completion as Dr. Vasquez placed the final sutures that would determine whether her innovative approach could save a life that had seemed lost only minutes earlier. The monitors displayed vital signs that painted a picture of a man whose body was fighting to survive against overwhelming medical odds. The final suture secured the reconstructed artery with a precision that seemed to defy the impossible circumstances under which the repair had been performed. Dr. Vasquez stepped back from the surgical site for the first time in 4 hours, her hands steady despite having just completed a procedure that would challenge the most experienced vascular surgeons working under optimal conditions in the world's finest medical centers. "Blood pressure is rising," Dr. Chan announced with obvious relief, his voice carrying the amazement of someone who had witnessed a medical miracle unfold before his eyes. "We're approaching normal levels. Heart rate is stabilizing." The arterial repair is holding perfectly, and there are no signs of continued bleeding from any source. The monitors displayed vital signs that painted a picture of complete surgical success, with every indicator showing that General Thornfield's body was responding exceptionally well to the complex procedures that had saved his life. The digital readouts confirmed what everyone in the operating room could see. They had just witnessed surgical excellence that transcended normal human capability. Dr. Harper stood in complete silence for several seconds, processing what he had observed during the past 4 hours. His 15 years of surgical experience provided no framework for the level of technical mastery that Dr. Vasquez had demonstrated, particularly during the final arterial reconstruction that had saved the general's life when conventional wisdom would have declared the case hopeless. "Elena, I need to apologize," he said quietly, his voice carrying genuine humility that replaced the skepticism he had brought into the operating room. "What you've accomplished here goes beyond anything I've seen in my entire surgical career. Your techniques should be taught in every trauma center in the world." Dr. Vasquez continued her methodical closure of the surgical site, her movements maintaining the same precision that had characterized every aspect of the procedure despite the physical and emotional demands of performing under intense scrutiny. Her suturing technique demonstrated mastery of tissue approximation that would minimize scarring while optimizing healing in a patient whose recovery would be closely monitored. Patricia Kowalski began organizing the surgical instruments with renewed appreciation for the excellence she had witnessed. In 25 years of operating room experience, she had assisted the hospital's most skilled surgeons through thousands of procedures. But the past 4 hours had redefined her understanding of what was possible in emergency surgical situations. "Dr. Vasquez, I've worked with exceptional surgeons throughout my career," Patricia said as she cleaned instruments that had been used in procedures that existed nowhere else in medical literature. "But what you've demonstrated today represents surgical innovation that will influence trauma surgery for generations to come." Dr. Rodriguez had filled pages in his notebook with detailed descriptions of techniques that would shape his entire surgical career. The procedures he had witnessed would be discussed in medical conferences and published in journals that reached trauma surgeons around the world. His training had been revolutionized by observing surgical mastery that pushed the boundaries of what medical science considered possible. The closure process proceeded with the same meticulous attention to detail that had characterized every phase of the operation. Dr. Vasquez worked with steady hands despite the knowledge that her every movement had been evaluated by colleagues who had initially questioned her qualifications based on gender rather than medical expertise. Dr. Chin monitored the general's responses to the final phases of surgery with growing confidence in the outcome. The patient's body showed no signs of the complications that typically accompanied procedures of this complexity, with vital signs indicating successful stress management despite the extended duration and technical challenges of the operation. The surgical site closure revealed Dr. Vasquez's mastery of cosmetic technique combined with optimal healing methodology. Her suturing created minimal tissue tension while ensuring perfect approximation of anatomical layers, demonstrating surgical artistry that complemented the technical excellence she had displayed throughout the procedure. Dr. Harper approached Dr. Vasquez as she completed the final skin closure, his professional demeanor reflecting the respect that had replaced his initial skepticism. "I want to discuss your techniques with colleagues at other medical centers. The innovations you've demonstrated should be shared with trauma surgeons who encounter similar cases." The operating room began transitioning from surgical intensity to post-procedure documentation as the team processed the magnitude of what they had witnessed. Every person present understood that they had observed surgical excellence that would be remembered and discussed throughout their professional careers. Dr. Vasquez removed her surgical gloves with the same methodical precision that had characterized every aspect of her work, her movements reflecting the calm professionalism that had never wavered despite the intense scrutiny and life-threatening complications that had tested her abilities throughout the procedure. The general's vital signs displayed perfect stability as the anesthesia process began, with every indicator showing successful completion of procedures that had seemed impossible when the complications first arose. Dr. Chun prepared for the patient's awakening with confidence that the surgical interventions had achieved complete therapeutic success. Patricia completed her instrument count and documentation with renewed respect for surgical excellence that had exceeded anything in her professional experience. The procedures she had assisted with would influence her understanding of trauma surgery for the remainder of her career, providing her with appreciation for innovation that pushed medical boundaries. Dr. Rodriguez closed his notebook containing detailed descriptions of surgical techniques that would guide his development as a trauma surgeon. The education he had received during the past 4 hours represented training that could not be obtained in any medical school curriculum, providing him with approaches to complex cases that existed nowhere else in medical literature. The surgical team prepared for postoperative procedures with the satisfaction of having participated in medical excellence that would be discussed in trauma centers around the world. Every person present had witnessed surgical mastery that demonstrated the irrelevance of gender assumptions when confronted with undeniable technical expertise. Dr. Harper began mentally composing the case report that would document surgical innovations witnessed during the procedure. His description would reach medical professionals who dealt with similar trauma cases, sharing techniques that could save lives in situations where conventional approaches failed to provide adequate solutions. The operating room returned to its normal rhythm as equipment was cleaned and prepared for the next emergency case. But the 4 hours that had just concluded would be remembered by everyone present as the day they witnessed surgical excellence that redefined their understanding of what was possible in emergency medical situations. Dr. Vasquez completed her final documentation with the same attention to detail that had characterized every aspect of her surgical career, knowing that her techniques had been proven beyond question in the most demanding circumstances possible. The general's life had been saved through innovation and expertise that transcended any doubt based on gender or appearance. General Thornfield's eyes opened slowly in the recovery room, his consciousness returning gradually as the anesthesia wore off and awareness of his surroundings began to filter through the haze of post-surgical medications. The first thing he noticed was the absence of pain that had characterized his condition before surgery, replaced by the manageable discomfort that indicated successful medical intervention and the beginning of his recovery process. Dr. Vasquez stood beside his bed reviewing his postoperative vital signs, her presence a stark reminder of the assumptions he had made about her qualifications based solely on her gender. The monitors displayed perfect stability across every measured parameter, painting a digital picture of surgical success that exceeded even optimistic projections for his complex case. "Doctor," he said weakly, his voice still affected by the breathing tube that had sustained him throughout the 4-hour procedure. "I need to know what happened during my surgery. The last thing I remember was questioning your qualifications, and I wake up feeling better than I have any right to expect." Dr. Vasquez approached his bedside with the same professional demeanor that had characterized every interaction they had shared, despite the doubt and resistance he had expressed before losing consciousness. "Your surgery was successful, General. We removed 7 pieces of shrapnel, repaired a damaged spleen, and reconstructed a major artery that ruptured during the procedure. You should make a complete recovery." The general attempted to process this information through the fog of medications that still affected his mental clarity. He had been prepared for complications, extended recovery periods, and possible permanent limitations based on the severity of his injuries. The reality of waking up with minimal pain and excellent prognosis challenged everything he had expected from his medical situation. Margaret Thornfield entered the recovery room at that moment, her relief evident in every aspect of her bearing as she saw her husband conscious and alert after the longest 4 hours of her life. She had spent the entire surgical period in the waiting area, alternating between prayer and anxiety while trying to reconcile her traditional assumptions about gender roles with the medical reality of their situation. "Marcus, thank God you're awake," she said, taking his hand while being careful not to disturb the various monitors and 4 lines that were tracking his recovery. Dr. Vasquez saved your life. The surgical team said it was the most remarkable procedure they had ever witnessed. General Thornfield looked between his wife and Dr. Vasquez, beginning to understand that his prejudices had nearly cost him the medical care that had saved his life. The irony was not lost on him that the surgeon he had doubted based on gender assumptions had proven more capable than any male surgeon he had encountered throughout his military career. Dr. Vasquez, I owe you an apology that goes far beyond anything I can express while lying in this hospital bed, he said, his voice growing stronger as the medications continued to clear from his system. My assumptions about your capabilities were based on ignorance and prejudice that have no place in life-or-death medical situations. Dr. Vasquez accepted his apology with the grace that had characterized her professional demeanor throughout their entire interaction. General, your concerns were understandable given your background and experiences. What matters is that the surgery was successful and you're going to make a complete recovery. That's the only outcome that truly matters. Captain Walsh entered the recovery room carrying updates from the Pentagon about the general's condition and a widespread interest in his case among senior military officials. The successful surgery had generated discussions throughout the defense establishment about medical excellence that transcended traditional assumptions about gender and capability. Sir, I have updates from Washington about your condition, Captain Walsh said, approaching his bedside with obvious relief at seeing him conscious and alert. The Secretary of Defense sends his regards and wants you to know that your surgical team has received recognition from the highest levels of military leadership. Dr. Harper appeared in the doorway, having completed his post-operative documentation and eager to speak with the general about the surgical excellence he had witnessed. His transformation from skepticism to admiration represented a professional awakening that would influence his medical practice for the remainder of his career. General Thornfield, I wanted to personally tell you that Dr. Vasquez performed surgical miracles during your procedure, Dr. Harper said as he approached the bedside. The techniques she employed saved your life in situations where conventional approaches would have failed. You were treated by one of the finest surgeons I have ever encountered. The general listened to these testimonials with growing appreciation for the expertise that had saved his life while he was unconscious and unable to witness the surgical mastery being performed on his behalf. His recovery represented more than just physical healing. It marked the transformation of assumptions that had guided his thinking throughout his military career. Patricia Kowalski stopped by the recovery room to check on the general's condition and to share her perspective on the surgical excellence she had witnessed. Her 25 years of operating room experience provided authority to her assessment of Dr. Vasquez's capabilities that even skeptical observers would find difficult to question. General, I've assisted thousands of surgeries in my career, Patricia said with the confidence of someone whose professional opinions carried significant weight. What Dr. Vasquez accomplished during your procedure represents surgical innovation that will influence trauma medicine for generations to come. You were saved by techniques that exist nowhere else in medical practice. Dr. Rodriguez entered the recovery room, carrying his notebook filled with detailed descriptions of the surgical procedures he had witnessed. The education he had received during the general surgery would guide his development as a trauma surgeon and provide him with approaches to complex cases that could not be learned from any textbook or residency program. The general's vital signs continued displaying perfect stability as his body responded to the complex procedures that had saved his life. Every indicator showed successful healing and recovery that exceeded medical expectations for cases involving his level of trauma and surgical complexity. If you connected with this story of hidden strength and proven excellence, drop a comment about what resonated most with you, or share if you've witnessed similar courage and capability in real life. Sometimes the most qualified person doesn't look like what we expect, but their actions speak louder than our assumptions. Margaret squeezed her husband's hand as the full impact of their experience began to settle over both of them. Their traditional assumptions about gender roles have been challenged and ultimately proven wrong by medical reality that couldn't be argued with or dismissed based on personal preferences or social expectations. General Thornfield looked directly at Dr. Vasquez with the respect that should have characterized their first meeting, his expression reflecting genuine appreciation for expertise that had transcended every doubt he had expressed. "Doctor, I hope you'll accept my gratitude for surgical excellence that saved my life despite my inappropriate skepticism about your qualifications." Dr. Vasquez smiled for the first time since entering his hospital room, her professional satisfaction evident in the knowledge that surgical excellence had proven more powerful than prejudice. "General, your recovery is the only thanks I need. Medicine works best when we focus on capability rather than assumptions, and today proved that excellence comes in all forms." The recovery room settled into the quiet rhythm of successful postoperative care as the general's body continued healing from procedures that had redefined everyone's understanding of surgical possibility and proved that expertise transcended every assumption about gender, appearance, and traditional expectations in high-pressure professional environments.